So now the 9 happy months of pregnancy are over and this is the time for climax. How to decide whether to go for a normal delivery or a planned C-section? Which is good for me? Whether I'll be able to tolerate, which I have heard that the labor pains are very painful, and will my body bear that? So how to decide what is good for me and what is bad for me? Hello everyone, I am Dr. Himani Sharma, obstetrician and gynecologist practicing at Apollo Hospitals, Navi Mumbai. Today we are here to discuss regarding the modes of delivery. So as we know, there are 2 ways to deliver your baby in this world. So either it can be a normal vaginal delivery or it can be a planned C-section. So what is the difference between two? So by normal delivery we means that the baby is coming out through the normal birth passage or the vaginal canal. And there are certain advantages obviously with normal delivery, but again we need to know about C-section also. C-section is known as lower segment cesarean section. It is a cut is made in your lower abdomen and through your abdomen the baby is delivered. So there are certain pros and cons of both delivery. It's not that we have a choice always that to choose between these two, but actually it is your doctor's call, and depending upon the need of the decision is taken. So there are certain indications for cesarean section where your doctor will advise you that you can't opt for a normal delivery and you have to go directly for C-section. So either it can be a planned or elective C-section or it can be an emergency cesarean. So by planned or elective C-section, what we mean is that there are certain indications like maternal indications, medical conditions which are life-threatening to the mother like heart diseases, respiratory illnesses or high BP, where normal delivery will pose risk to the life of the mother. There your doctor will advise you to go directly for cesarean. Secondly, there can be certain delivery conditions like low-lying placenta or placenta covering the mouth of uterus where a normal delivery is not possible. Third, there can be certain fetal indications. Suppose baby is already compromised and baby is in distress where baby can't tolerate the labor pains, then your doctor will directly advise you to go for C-section. Now, what do we mean by emergency section? By emergency section we mean that you are already in labor and there is certain situation like suppose the baby has passed motion inside or baby is in distress or your labor is not progressing the way it should progress. You are having a prolonged labor, the mouth of uterus is not opening properly. There, for the safety of your baby, your doctor will recommend you to go for an emergency C-section. Then there can be abruptio placenta or heavy bleeding where immediate delivery is required. So in these situations, emergency cesarean is done. Now, coming to the advantages or the pros and cons of normal delivery and C-section. So obviously in cesarean, when the baby is coming out directly from abdomen, the baby is not facing any distress. So there are minimum chances of any risk to the baby. Secondly, you are not tolerating the labor pains. So there is no pain of delivery. But definitely postpartum or on second day of C-section, you might experience a bit of pains which will be taken care by your doctor. Now the advantages of normal delivery is that you will have pain only during delivery and not after that. Recovery is faster in normal delivery. The blood loss is definitely less in normal delivery but more in cesarean. Cesarean itself has risk of anesthesia and risk of surgery, injury to other organs. So obviously there are certain pros and cons with both the modes of delivery. So we can't actually differentiate or we can't actually decide on the basis of advantages and disadvantages. So to know whether what your condition demands or whether you are a candidate for a normal delivery or vaginal delivery, definitely leave that decision on your doctor. If you have any doubts or anything, you definitely consult your doctor. Thank you.